And I want to welcome everyone again to today's webinar. We're really happy to have you joining us. We are talking today about child trends, resources for supporting the mental health and well-being of children and families during COVID-19. I am Janet Porter, and I am the Training and Technical Assistance Coordinator for the Northwest PTTC. Note that the views expressed in the webinar today do not necessarily represent the views, policies, and positions of SAMHSA. Next slide. So for those of you who may not be familiar with the Northwest Prevention Technology Transfer Center, and we are hosting this webinar today jointly with the Northwest Mental Health Technology Transfer Center. But the PTTC is actually a partnership between the Social Development Research Group in the School of Social Work at the University of Washington, the Prevention Science Graduate Program at Washington State University, and the Center for the Application of Substance Abuse Technologies at the University of Nevada, Reno. Next slide. So I want to just let everybody know we have a PTTC webinar coming up, so just save the date for that. That's going to be on lessons learned from implementing EBPs or evidence-based practices in a virtual environment. So I think that should be helpful to a lot of folks, we hope, and that's going to be on July 16th. It'll be from 11 to 12:30 Pacific, so be watching your email for that. That information will go out again on our listserv. And now I think it's my pleasure, if you want to move to the next slide, to introduce Christina Clayton, and she is the Director of the Mental Health TTC for the Northwest region. So Christina, I'll turn it over to you.
Great, thank you so much. I am so honored to be part of supporting this important content from Jessica for our networks, especially during all that we are facing right now. It just couldn't be more important. So my name is Christina Clayton. I'm the manager of the Northwest MHTTC, and it's a nationwide network that is supported by SAMHSA with the purpose of disseminating and implementing evidence-based practices as well as other effective practices for mental health issues in the behavioral health workforce. You'll get all these slides, so I won't read them all to you, but essentially our goals as a regional network and as a national network are to ensure availability and delivery of free publicly available training and TA, heighten awareness, knowledge, and skills of this workforce, to accelerate the adoption and implementation of effective practices, and to foster alliances within our community. Next slide. So being a nationwide network, we cover all regions and have a national presence so that our training, resources, and support is available for free. And all of our regional and national centers have a tremendous amount of amazing content at the click of a button. So you can see our link, and from our website, see all the regional centers as well as all their free content. Next slide. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We were funded in late 2018 and provide training and technical assistance in evidence-based practices to Region 10, but also quite nationally at this point because of the virtual environment. Next slide. Just some of the examples, probably a little hard to see, but when you go to our website, you can see all our free resources, including upcoming training events, live webinars, archived webinars, self-paced free online courses, and practitioner tip sheets. What also is helpful is that we also disseminate events and things through our website from other centers or other agencies. So if you have something you'd want to feature to our center, we can certainly put it up on our slider or put it in our newsletter. Next slide. You can keep in touch with us and register for our newsletter. You can go to our website. We're on social media, and so we share a lot of free training opportunities. So you'll get these. You can follow up later, but just wanted to say there's lots of ways to stay in touch. And then next, we'll just want to talk about language briefly. This covers, I think, everyone in the field, but it's always our intention, and we present this in all of our webinars about being really mindful of using language that promotes recovery and culturally appropriate terminology. We encourage everyone to use and champion person-first language, which emphasizes the individual, not a condition or diagnosis. This demonstrates respect for a person's dignity and worth. Now I'll turn it over to our school mental health lead, Kelsey Schmitz. Thank you so much.
All right, thank you, Christina. It's great to be with you all today and great to be in partnership with the PTTC and our core Northwest MHTTC. I'm Kelsey Schmitz. I work for the University of Washington at the SMART Center, the School Mental Health Assessment Research and Training Center. And we support the school mental health workforce in Region 10, Alaska, Oregon, Washington, and Idaho. And the information on this slide shows you a variety of ways that you can get in touch with us. We send out monthly newsletters as well as training and resource blasts. At the end of the webinar, we'll provide a link for you so you can join our newsletter and be in the know of what we are offering. Next slide, please. So the Northwest MHTTC and the UW Smart Center have been partnering these last several weeks with several Northwest organizations to bring you the Wellbeing Series that offers a variety of virtual learning opportunities for kids, for families, and educators, focusing on mental wellness and suicide prevention. And this session is included as a part of that larger series. You can read more about the Wellbeing Series by visiting the website on the slide. We'll provide that again at the end, and checking out the other events planned. And if you have questions, you can reach out to my colleague, Megan Lucy. And this next slide, just again, provides information about our funding and reviews our goals again. And now I want to take the opportunity to introduce our speaker today. Jessica Dim Bartlett is the Program Director of Early Childhood Research at Child Trends. She conducts evaluation and applied research on interventions to promote the emotional and relational well-being of children and families exposed to trauma and adversity, including child abuse and neglect, child and parent mental health problems, and natural disasters, with a focus on prevention and the promotion of resilience. Dr. Bartlett is the principal investigator of a randomized control trial on the impact of newborn behavioral observations on maternal mental health and mother-infant relationships at Harvard Medical School, a lead evaluator for the Child Trauma Training Center at the University of Massachusetts Medical School, and a developer of a toolkit to mitigate childhood trauma in the face of disasters and pandemics. Dr. Bartlett serves on the steering committee of SAMHSA's National Child Traumatic Stress Network and as the co-chair of the NCTSN Evaluation Community of Practice. And at this point, I'm going to turn it over to Jessica. Thank you for being here with us today.
Thank you so much for having me. I'm really pleased to be here. This feels like such an important, timely topic, and love that you got right to it. And so welcome everyone. Thank you to everyone out there who's attending. I've been asked today to describe some of what Child Trends has been doing in terms of supporting children's mental health and well-being during the pandemic. And I'll be trying to also make explicit links from the actual resources to practice, and would love to hear any questions you have. I think we're saving questions to the end, but please type them in along, all along the way if there are particular applications or groups or issues that you want to hear more about. I'll also describe some of our recent work on racism and equity, since it feels quite important right now to acknowledge the social justice context that children and families are experiencing right now. It's just hard to parse COVID out from all of that right now. So that may be another interesting point of discussion. All right, so what I thought I would do is begin with one of our most widely used resources, actually, of all time. And the very first resource we put out on COVID-19, and this is resources for supporting children's emotional well-being during COVID. And this particular resource has guidance and recommendations and resources that are a product of a wonderful partnership between child trauma experts, including myself, but not limited to myself, at Child Trends and at the Child Trauma Training Center at UMass Medical School. And our focus here really was to highlight the point that compared to adults, children are much more vulnerable to the emotional impact of traumatic events, broadly speaking, and need adults to provide care and information and protection from the adverse effects of pandemics in particular. in order to be able to promote their emotional well-being as this public health crisis unfolds. I'm sure you have all found in quite unpredictable ways at times. And in addition, with all of the attention that you may recall, that came up around physical health at that time, we really felt like it was important to advocate for a focus on emotional health. And that is still the case. And actually, we're putting together a mental health resource as we speak. And I will talk about that a little bit later. So we know, of course, that everyday life has changed in so many ways and will continue to change for most people, often with very little notice. And the children are really struggling, definitely to different degrees, but with significant adjustments to all these routines, whether it's closure of schools, homeschooling, childcare closures, not seeing friends, social distancing, home confinement, all of which really can interfere with their sense of structure and predictability and security. And we also know that those harmful effects of feeling disconnected, of feeling that change, and of course, of some of the more traumatic experiences associated with the pandemic, began very early in life. So young children, even infants and toddlers, are incredibly keen observers of people and their environments and their communities, right? And they notice and they react to stress when they see it in their parents and other caregivers, and also in their peers. And they understand kind of the general zeitgeist, even if they can't explain it at that age. In some cases, they may be asking direct questions about what's happening now or what will happen in the future, and may behave differently. One would expect that in reaction to some of these related feelings, which include fear and worry and sadness and anger and about the pandemic and what they're going through as a result of the pandemic. The other thing is that children really, especially I think young children, but I would say of all ages, tend to worry about their own safety and the safety of those they love and how they will get their needs met. So this particular resource focuses on that. And while we know that, of course, most children won't develop PTSD, if the history is any lesson for us, we do know that there are other children who really do develop significant mental health problems, including but not limited to post-traumatic stress. And most of the research that supports this particular document and other documents we've done on the pandemic, you can imagine, come from research on other types of natural disasters, given that there really there hasn't been a real pandemic like this since, 1918. So we are extrapolating, and one of the other things I would advocate for is anyone who's in the research community or has access to advocating in the research community can really help by pushing us to gain increased knowledge in this area so that we can really tailor services to kids and families' needs. One of the groups of families I really worry about are those with prior trauma or pre-existing mental and physical health issues or developmental problems, and those with parents who are struggling with mental health disorders and substance abuse disorders, economic stability, who are all at especially high risk for developing emotional disturbances during the pandemic or after. And finally, in this, we really wanted to emphasize a focus on an ecological and social determinants of health approach, because broader environments, as we know, play such an important role in children's vulnerability and resilience. And in the face of natural disasters, we assume also in the face of pandemics. So we provide recommendations not just for caregivers and children and resources for those groups, but also for communities, states, territories, and tribes. One of the things that has been very worrisome to me during this period is the amount of pressure and time and, kind of the requirements around schooling, all of that stuff all goes on to parents. And there isn't, it's at a moment where many of the supports disappear. So the first three recommendations from this resource are noted on the slide. And first, just to remember that, of course, children's responses to stressful events are unique and varied. Some children may be irritable and clingy, and some may regress, demand extra attention, have difficulty with self-care, sleeping and eating. Adolescents may engage in more risky behavior. New and challenging behaviors are just natural responses to this sort of situation. So adults can help by showing empathy and patience, but also by calmly setting limits when needed. I'm finding in my interaction with parents that because there is so much adversity going on right now, limit setting can be really hard. And yet, I'm sure, as you all know, it is an important way to create a safe holding environment for children. So not a great idea to kind of let all routines, all limits, and all of that kind of fall apart. Although I recognize that it can be very challenging to maintain them as well. So second, we know that really the primary factor in recovery from any traumatic event, including disasters, is the presence of a sensitive and caring adult in a child's life. And even when a parent isn't available, children can benefit greatly from care from other adults. So there are cases in which, home is not a safe place, but foster parents and relatives and friends may be able to offer children consistent, sensitive care that helps protect them from the pandemic's harmful effects as well. And then third, this whole issue of physical distancing, which I wish we had referred to it as that instead of social distancing from the beginning. I think that set people up to assume that they were not going to be connected, and we know that humans are incredibly social animals, and children are no exceptions, and parents are no exception. So we really need to focus on the physical piece of distancing and actually go out of our way to compensate for the social distancing that inevitably comes along with it. Kids need quality time with their caregivers and other important people in their lives. Older children and adolescents need contact with peers as well. That's really their social circle, and it's disappeared for many youth. And social connectedness just generally tends to improve both children and adults' well-being. So we need to use really creative approaches to staying connected, and I've seen some wonderful ones out there. I'm sure you have too. So certainly, like, whether it's a throwback to writing letters or, interesting ways to use technology or celebrating big events through car parades, all of those things are actually quite meaningful for children and worth engaging in. All right. So just to continue along with this particular resource, we also know how important it is to talk to children and to do so in age-appropriate ways. Children tend to rely so much on their imagination to fill in blanks, even at older ages. And when they don't have that information, usually misinformation sneaks in there. So adults really need to make themselves available to have these conversations and to initiate these conversations if children aren't initiating themselves. But then to think about the content, so to use language that young kids understand. For instance, kids understand what fairness means as early as 1, they start to get a sense. By 3, they have a pretty well-developed sense. And you can certainly talk about people being hurt as something that feels unfair. With older, children and adolescents, you may have more kind of philosophical conversations in addition to some of the concrete "what's happening to me" conversations. And one of the things this resource has is a bunch of links to other resources that can help you have those conversations and provides a little more detailed by age group. On the other hand, we want to be thinking about limiting children's exposure to adult conversations and to media and to scary depictions of what's going on. There are just too many households where and I'm guilty of this myself. I had to actually, one of my children who knows what I tend to say about these things called me out the other day and said, that TV has been on the news and sitting around, for the last hour. So, we know that kids are, their little ears are listening. And so we have to be really, really conscious about what kind of information is floating around when they're in earshot. So the other thing that's on this slide is the 3 R's that you may or may not have heard of before. I tend to use it because it's nice shorthand. And the 3 R's are reassurance, routines, and regulation. So meaning that adults will need to reassure children about their safety and the safety of loved ones, and tell them that it's an adult's job to keep them safe. Adults should be helping maintain routines for themselves and for children, because it really provides a sense of safety and predictability. And what I've seen is a pretty full spectrum. So I've seen kind of what we want to see for kids and families, which is regular bedtimes, regular meals, times you tend to be free to play, times to learn. But I've also seen kind of an anxious, rigid response to it, where every single 20 minutes or half hour, 15 minutes are scheduled throughout the day, particularly when parents were put in this challenging situation of homeschooling. And what I have really noticed is that kicks up everybody's anxiety following that schedule, and kind of having things be so rigid that kids can't have a little bit of room to move. So you don't want to go so far to that end of the spectrum that you've lost some flexibility for allowing kids to have the natural reactions they have, or to need some space and time if they do. And then finally, this issue of self-regulation, which I'm sure many of you are familiar with. We know when children are stressed, their bodies mount their stress response systems are activated, and that can really exacerbate difficult feelings and impulsiveness, and can become very hard for kids to manage if they don't have a lot of experience with it. So to help them manage those types of reactions, it's important to first validate those feelings. They're real, regardless of whether you find them reasonable or not. That's just the way ours are. And encourage them to engage in activities to help them self-regulate. So many of you probably have your own techniques. Feel free to share them or ask about them. But I'm thinking about things like exercise, getting outside, breathing, mindfulness, all of those types of things. And one of the best ways to help kids get started who have not done a lot of that is to help them co-regulate, to do it along with them, to help them figure out how to negotiate difficult emotions that are coming up. Okay, so next I wanted to just talk about the importance of keeping children active and busy. And I don't mean overscheduled, and as I said, every 15 minutes you have something to do. But we know that when children are bored, their levels of worry and disruptive behaviors tend to increase. And we also know that children really benefit from ample time to play and to engage in joyful, and learning experiences without worrying or talking about the pandemic. They need breaks from those conversations and to just experience normal activity. The other is a sense of self-efficacy, right? So research really shows quite strongly that children, when children have a sense of self-efficacy, some agency and control in the world, especially during times of fear and uncertainty, they often feel more in control when they can play an active role in helping, whether it's helping in the family, helping their communities, and it can be even small ways. So for very young children, it might be as simple as sending a letter to, an elderly person or picture, or washing your hands to help, keep everybody safe. And as kids grow older, of course, they can engage in all sorts of important advocacy for their own health and the health of the community. Then we also focused on the fact that research is clear that children's well-being depends largely on the well-being of their parents. And I was so happy to see on the list on one of the earlier slides that was a topic. And you know, we know that children's well-being is very dependent on the well-being of their families, specifically their primary caregivers. So caregivers actually really have to be able to take care of themselves so that they can have the internal well of resources to be able to provide nurturing care for others, which is the type of care that children need. And that includes enjoyable and restorative activities, in some cases seeking help from a mental health provider. But too often this is, I don't know whether you all find this, but I certainly do, that this whole idea of self-care and staff wellness is an afterthought or a footnote. But if I had my way, you know, social service agencies actually would require this of staff and set up ways to support their self-care. This is, for instance, one of the things I recommended. I'm on a national working group for COVID and childcare for Save the Children, and everybody's quite worried about the program's opening and having both children and staff who are under, and leadership really, all of whom are under extreme stress. So how can we set up rooms, spaces, you know, breaks, etc., so that people can kind of get back to a sense of wellness. Great. Okay. So 2 final points on this particular resource. As I mentioned, you know, emotional and behavioral challenges are to be expected during a pandemic. As everyone adjusts to a new sense of normal. I would say that my husband would absolutely say that my behavior has changed and that it's noticeable, and I've noticed his, never mind our children. So this is, you know, something to pay attention to. And we really want to think about children showing ongoing patterns of emotional or behavioral disturbances that don't resolve with typical, you know, good enough caregiver support. So in those cases, it may really be important to get professional help. And then children just need, back to the idea of children needing to feel safe and secure, but also hopeful and positive about their present and future. And adults can really help children by focusing their attention on the many ways in which people come together, find creative solutions to difficult problems, overcome adversity during the pandemic. And we are bombarded with all of these negative images, and it's really, really critical that we counteract some of that anxiety-provoking material and give kids hope to show, you know, that it is possible, that we can get through this, that people are good, even if there are some, you know, not so great people. And I think just talking about these stories can be healing and reassuring to children, but I would say they're also healing and reassuring for adults. I've noticed certainly on social media, there's a mix being shared and a lot of positive response to some of the strengths and movement forward that we've been making. So just to mention that the remainder of this resource has a very long list of other resources sorted by audience. So for children, for parents and other caregivers, and also for community, states, territories, and tribes, because again, getting back to that social determinants of health perspective. And another thing just to note for everyone is once you have these slides, if you don't have them yet, you will. And every resource that I've put on here is clickable. That is, it's linked directly to the resource itself. So it should be that you should be able to take this deck and pull up the resource quite easily. But my contact information is at the end if you have any questions or have any difficulties doing that. All right, so I thought we'd just pause for a moment because I'm assuming that the resources we have put together are not the only ones out there that have been of value. And I think it's great when we share these with one another. So what resources have you found to be the most helpful in your work to support children's mental health during COVID-19? And we're opening up the chat so that you can start to put some of your answers in there. I'll just give you a moment.
So Jessica, there's some responses coming in. Wow, a lot of them.
Yeah, I see that. How
Moo
great.
resources. Can you see them coming in? Do you want to?
I
Do you
can't
want me to read
see
through them?
them, but I can see the number going up, which is great.
Yeah.
You see them?
Uh-huh. Yeah. So lots lots of great ideas from other parents.
Mm,
COVID coach app, podcasts from a number of sources. And
great.
there's some links coming in, so I do appreciate those of you who are putting some links to resources in the chat as well. Um, uh, uh, yeah, so a lot of you are really have a lot of great responses here. Child mind resources.
Mm-hmm. Those are
Um,
great. Yep.
yeah, um, breathe for change.
Mm-hmm.
Somebody mentioned they've been doing video gaming with kids that they work with. Um, uh, yeah,
Excellent. Well, it sounds like there's a
yeah,
lot of variety there, and
mhm.
much for you all to ponder and look over. And I know, is it right? We're going to leave a few minutes at the end once the webinar is over, so that people can collect these
Yes,
resources.
absolutely. Yeah.
Good. We don't want you to lose anything. Okay. Well, thanks for responding, and I see that you're still going. So keep at it if you would like to, and you find it helpful. Okay, so this next resource that I'm going to talk about from Child Trends was the second piece that we put out on supporting young children during the pandemic. And it focuses on 5 particular protective factors that are especially powerful in promoting resilience, at least in the face of disasters, and we assume in the face of pandemics. We'll know more later as the research continues. And it provides recommendations for parents and other caregivers in the same way, also communities, states, tribes, and territories. I think with this piece, we felt especially dedicated to highlighting strengths, hope, and positive action in the midst of all of the doom and gloom. So kind of picking up where the last resource left off felt important. So I'll just go through the protective factors that we identified. I know that I just mentioned sensitive and responsive caregiving. It's one of those things that should be at the top of every single list always for kids. But I won't spend long on it since we've talked about it. But I did want to mention, I can call everybody's attention. You may have been following it in the news or in your own work, but we know that rates of mental health problems and substance abuse disorders, child abuse and neglect, intimate partner violence, poverty, etc., all tend to rise during these times. And that presents a very significant challenge to being able to care for children in sensitive ways. Very stressed caregivers are often not able to provide the type of care that children need. So this needs to be a real focus in terms of how can we bolster parents enough so that they can provide sensitive care? How can we use kinship caregivers, not use, but, employ the help of kinship caregivers and other adults in kids' lives to fill gaps if they need them. And we also know that the mental health infrastructure is just woefully inadequate. So well before the pandemic ever hit, we were completely unable to meet the mental health needs. We just didn't have enough providers and evidence-based practices. And along with that are many structural barriers that tend to interfere with, in particular, families of color and poor families' access to those services. And of course, in rural communities, similarly, it's a real challenge. So these issues are not issues, of course, that an individual mental health provider or other service provider can solve completely on one's own. They require short-term and long-term policy solutions, in my opinion, but also support from the mental health and family service community, who are probably doing some pretty innovative things in order to make this happen under difficult circumstances, for instance, not being able to be in person. And I think it's important to emphasize to stressed parents and caregivers that even short times, short periods in which they can play, follow a child's lead, engage in an adolescent's favorite activity, if they'll let you, but your availability, etc. But even these short little periods scattered throughout the course of the week can have a huge impact in terms of bolstering children's sense of safety, security, and certain, well-being during uncertain and scary times. So what we don't want to do is make it an all or nothing prospect. There are many families who just can't spend a lot of time with their kids right now. So, how can they grab a few minutes here and there and still be able to be wonderful parents? All right, so I'm a huge proponent of this idea that basic needs of children and families are not simply a resource issue. They obviously are an issue of whether people have enough food and clothing and shelter and medical and mental health care, which, by the way, I always include as a basic need. They're all essential to protecting children's well-being in stressful times. And we need those supports because if you are busy worrying about whether you're going to eat or you're not eating, for example, it's pretty difficult to care for your child and for your child to feel safe and secure and be able to get through the pandemic in a way that they are healthy from a psychological standpoint on the other side. We move on to the next protective factor, which is emotional support for children. And I'm not going to spend a lot of time here because, of course, that's what the last resource was about. Aside from just saying that mental health and other service providers really can facilitate access to home visiting, early intervention, child and family mental health programs, teachers, and other services by offering remote options to make sure that children have the social interaction and support that they need. So here, again, is support for caregiver well-being, which I've talked about. So we don't need to go into it again, but feels like a critical piece of resilience for kids. And I think we often talk about it as a way of preventing burnout and turnover and all of those things, and secondary traumatic stress or vicarious trauma, but not actually as much about it as a vehicle for being able to parent effectively or to have family well-being. And so I always add it to that context as well. And then finally, this issue of social connectedness, which is so critical, which again, you can see obviously there are a lot of similarities in the two because what supports emotional well-being often supports resilience, and there's a lot of overlap that way. Right. And it would be great if at some point, if you have questions for each other or me about, social connections, what type of social connections work for different age children. I think it's quite different for different ages. And I think one of the other thing I guess I wanted to say here was how important it is that community members and service providers, family members, are checking in regularly with families who have children, and especially those who have had prior issues with mental health or substance abuse or threats to safety. In person is best, but remote will have to do in some instances. But this is to address basically the fact that we've lost much of our public surveillance system. So, for example, for child abuse and neglect, the reports have gone way down in most states, and yet the indicators of child abuse and neglect, like emergency room visits, unintended injuries, et cetera, have gone up. So we know that that is not, it's a matter of reporting. It's not a matter of the fact that less abuse and neglect is happening in the pandemic. And one of the main sources of reporters are teachers, mental health, mental health professionals, and people in childcare. And once they are no longer having their eyes on children in a regular way, we're losing all this mandated reporting that would have happened and hopefully alerted us to children who are really in trouble and need our help. And we are expecting, an uptick once schools resume and kids are in various types of care and activities again. Let's go to this one. Okay. So I thought another piece I would highlight is just a simple but powerful statement by Carol Emig, who is our president. And her point here was to alert us to the fact that there are children who are being overlooked if we think of all children and all families as the same. And so you can certainly go to the full statement by clicking on it if you want to see, but you'll see that she calls out disproportionate effects of the pandemic on communities of color and their lack of equitable access to health and mental health care, and the high risk and likelihood that other inequities are going to get worse during and after the pandemic. She also emphasized other groups that are very vulnerable during this time. So 7 million infants, toddlers, and children with disabilities who, with their families, are really struggling with the sudden absence of services and accommodations in schools and are, and remote instruction, right? And then all of the kids who are living in the care of grandparents. And grandparents, as we know, are really at heightened risk for COVID. And so what does that mean for kids who are in their care? What will happen if they get sick? What will happen if they go out into the world and bring the virus back? So these are families we really need to be thinking about. And then finally, all of the children who are currently in foster homes, who may face challenges visiting with family and siblings or lose critical reunification services. Some of you may have heard there are actually states in which there are lawsuits going on because biological parents are unable to visit with their children and maintain, a relationship that way because of the restrictions around safety for COVID. And that's been very painful. So for instance, in one of the studies that I'm leading now on parents who, with infants who struggle with opioid disorders, there was one mother in the program who was just about to be reunited when all of this hit, and it completely derailed it. And I've heard similar stories of adoptions that haven't been able to go through. So certainly we need to be thinking universally about all children's well-being, but also in very targeted ways for kids who are especially likely to be struggling. Okay, so we're going to stop before we move on to another topic of trauma screening. And I wanted to ask you all about how much you know about trauma screening. Either not much, this is a relatively new topic to me, a little bit, I have some familiarity with this topic, I know a fair amount about this topic, or I consider myself an expert in this topic. So great to see all your responses come in, thank you. So I'm seeing a little bit and a fair amount and not much kind of vying, but it seems like the most and a little bit and very few experts in this topic. So that means it's probably a good topic to discuss. And any of those of you who have knowledge about it will be interested in hearing from you at the end. All right, so a little bit is our winner. So you have some familiarity for the topic for the most part. All right. Let's see if I can get it to move on. Technical glitch again. There we go. All right. So screening has become a quite, I was going to say contentious, but that's not exactly right. There's a robust conversation going on about how to engage in adversity and trauma screening effectively. And so what we decided to do was to put together a resource, and this was largely born out of our response and others' response to serious concerns that we have about, in particular, adverse childhood experiences, surveys, indexes, checklists. Probably many of you have seen them, and that movement, and how states like California have begun using that tool universally. And, you know, there are many issues with that particular tool and that type of tool. So much so that actually last month, Robert Anda, one of the original authors from the study, which is groundbreaking and has given us wonderful information about the link between childhood adversity and many of the causes of death in adulthood and illness, et cetera. But he specifically stated in both a video and an article that ACEs checklist should never be used for screening. And so we wanted to make sure, you know, there are low-hanging fruit, and we wanted to make sure that people were well educated before choosing screening tools. There can be a lot of unintended consequences, is I guess what I want to say. There's real potential for re-traumatizing children and families. There can be contribution to stigma and a real deficits focus. There's a real lack of age and culturally sensitive screening tools. And this focus of some of them, but certainly the short checklists like ACEs that focus on household issues, is a misleadingly narrow conception of adversity that leaves out children who are affected by their environments. It's not a social determinants of health perspective. And we know, of course, that poverty, community violence, historical trauma, racism, and so much more have profound impacts on children. And so to focus on a short list of things only that go on in the home, I also worry allows many children to fall through the cracks, particularly children of color and children who are experiencing, you know, barriers to care. So because if they're experiencing a lot of environmental adversity, if you use a tool that doesn't even measure it, that won't even be part of the consideration in terms of putting together a treatment plan. So here is the actual resource. And so what we're trying to say here is that it's really critical to provide training for service providers across the child and family service system in trauma-informed care. And there's a difference between trauma-informed care and trauma. So a one-shot trauma training is great. It is not trauma-informed care. So that includes actually trauma-informed care includes a wide range of approaches at every single level of an organization, preferably in a community that's well coordinated. And it lays a foundation for comprehensive screening and follow-up. And although the term is a little amorphous and has been defined in lots of different ways and operationalized in different ways in different programs, there's now a mounting body of evidence showing that many of the approaches use common elements, and those that do tend to have positive effects on child outcomes, which is very, very encouraging, although we need to continue to develop our knowledge in that area. And so one of the pieces that is really lacking is more sensitive tools for addressing adversity exposure, but also symptoms. So again, if you have a checklist of what people are exposed to, that doesn't tell you anything about how they're doing. And you know, we're missing good screeners for infants and toddlers, despite the fact they actually are disproportionately exposed to adversity. So for instance, they experience and die of child abuse and neglect at much higher rates than older children, particularly ages 1 and under. And so, and then, as I was saying before, we have very few culturally appropriate tools. And this is certainly an instance in which one size fits all is not appropriate, because kids all over the country have very different experiences of adversity that are specific to, whether it's their family, whether it's their culture, whether it's the particular area of the country they live in, the resources they do or do not have access to, etc. We also desperately need to increase the availability and accessibility of evidence-based trauma therapies and trauma therapists. And we already know, the good news is that there are many effective evidence-based practices with children. So child-parent psychotherapy, trauma-focused cognitive behavioral therapy, attachment self-regulation, and competency. I could go on and on. And if you're interested in looking at them, the California Evidence-Based Clearinghouse is a really good, they rate every single intervention and give you all the research on it. It's a great way to find out about EBPs. But of course, going back to the point of, we didn't have enough people who could provide these services to children before the pandemic. And now we expect the need will grow. And with the attention to screening, which is, I think, a good thing overall, we're going to be identifying more children who need help as a result. And if we don't increase the capacity to be able to address that, then we are going to be in trouble. All right. Then there's an issue which I always connect to, which is thinking about prevention, right? Ultimately, that is the most effective, the most beneficial for children and families. And so we need to be thinking about investing in prevention programs. So I don't know whether any of you have heard, I think it came from Irving B. Harris, but the fable of babies floating down the water, and someone jumps in to try to pick up, rescue a baby, and more babies keep coming down. Everybody keeps running in to rescue the babies. And then ultimately, someone says, you know what, I'm going to go to the top of the stream and figure out why these babies are getting thrown in the water, right? So we need both. It's really, really essential to have both prevention programs and intervention programs. And then finally, I just wanted to let you know that I put out a peer-reviewed article on this, and there's a new journal, if it's of interest to you, that we're just launching, very exciting, called Adversity and Resilient Science, and it's open access for the first 2 years. So please feel free to take advantage of that. Okay. Now I just want to move on to a resource that focuses on school trauma. I cannot take credit for this. These are my wonderful colleagues who do a lot of work in this area. And this resource is specific to educational institutions in which, and so my colleagues did a scoping review and found that nearly 60% of schools didn't offer any mental health treatment at all before COVID. And in addition, there's very little evidence about what works of the offerings that exist currently, never mind specific to pandemics or to racism, right? So state and local decision makers are really in the process of determining how and when schools should reopen, and we are in this important moment. And I was happy to see that the Council for Chief State School Officers recently noted that reopening plans really need to include considerations for trauma-informed supports in addition to academics and social distancing. Then for schools that didn't offer any mental health treatment services at all before COVID hit, supporting students experiencing trauma will largely fall on teachers and other non-clinical staff, which is a concern. And there's an alarming lack of evidence as to what works in terms of equipping classroom teachers versus mental health folks within schools in terms of, addressing trauma. So COVID is really presenting an unprecedented challenge for schools across the country. But on the flip side, some really good opportunities to focus our attention on how schools can do this well. And as students return, you know, and if we can really make some timely investments in intervention, development, and evaluation, we can improve this evidence base and get it to where it needs to be in order to support children and families. All right. So here are two other resources. One is strategies to support the administration of direct service provision during the COVID pandemic, and the other is focused on telehealth and home visiting and what home visiting can learn from other fields, medical fields and mental health fields that really have done some wonderful work in being innovative about how to use telehealth, particularly for families who don't have access to a lot of technology. So I just wanted you to be aware of these two, and the first tip sheet on the left is focused on our experiences in Southward Promise neighborhood partner agencies. So that's got a very specific program model that you might want to see. And the other tip sheet on home visiting programs is much more broad and thinking about how telehealth can be used. Then we have a plethora of trauma resources, and this has been an important piece of my work as well, and I have some great colleagues who've been doing this work with me. And so they're not necessarily focused on COVID, but as you might have noticed, as I've been talking all along, there are a lot of similarities in terms of what works with different types of trauma. So these are some resources that can help you understand terminology. So I loved that first slide on language and the power of language. And I don't know about you, but I think a lot of people, and certainly for a while I was quite confused about, well, what is the difference between ACEs and adversity and toxic stress and trauma? And, you know, they're really not interchangeable, and they're used interchangeably. So when we think about adversity, it may or may not result in trauma. And, you know, you might go through an amicable divorce, which is one of the ACEs, for example, and do just fine. But another kid might have a really hard time. So I think we need to make sure to differentiate adversity from trauma, which is, you know, a specific reaction to adversity, or, you know, that often manifests in particular symptoms that are related to post-traumatic stress. And then toxic stress is really the mechanism that is in operation. So the overactivation of the stress response system that in turn results in poor outcomes for kids. Then we did a piece on how to implement trauma-informed care to build resilience to childhood trauma. This was actually done with LA's Best and thinking about their after-school program, but we ultimately ended up writing a more widely applicable piece. And I've gotten a lot of requests for this diagram on the right that you see on the impact of childhood trauma, which came from this resource. And I just wanted to say, you have my full permission to use it. I put it there specifically so that when you have the slides, if you want to take it and use it elsewhere, that is just fine with me. Just make sure the Child Trends logo stays on it so that we have that acknowledgement, but help yourself. And then finally, that we've been doing some work around very young children, helping those who have experienced trauma and trying to help the childcare system and Head Start and Early Head Start figure out how to translate some of these trauma-informed principles into everyday practices. And it's complex. There's a lot that overlaps with early social emotional learning. And then there are pieces that are quite different, like the fact that kids who have experienced trauma have real triggers. So one example I often use is I was an infant and early childhood mental health consultant for a while, and I was in a Head Start program, and the cook did this beautiful job of laying out all the fresh raw ingredients before cooking a meal for the kids, and wheeled it by so that all the kids could see the things that went into the things they were cooking, you know, that they were going to eat later. And then they had this great discussion about, you know, food and what's in it and what they like, and they discovered new things they liked. So it seemed like such a great experience, except for there's this one little girl who's 4 years old who just kept falling apart every time it happened. And of course, you know, that the adage of trauma about, you know, let's not ask what's wrong with you, but what happened to you. And ultimately, this was a kiddo who had a pretty severe neglect history, specifically the denial of food. And so we had to rearrange the schedule so that she wasn't constantly exposed, and the space too. She wasn't constantly exposed to that trigger. So in some ways, this information is intuitive to people who are mental health folks or who are early childhood folks. And in some ways, it's really not, and quite distinct. Okay, so this is the piece I just didn't feel like it would make sense to do without. You know, I just feel like this is the context we are living in. I mean, it's always been the context we're living in. There's particular attention to it now. And so we're starting to develop quite a few resources in this area, if this is an area of interest to you. One was a statement from Child Trends on Fighting Racism. Another had to do with embedding a racial equity perspective in positive youth development. Another is our 5 guiding principles for integrating racial and ethnic equity into research, if that's something that you engage in. And then also around communication. So we're really trying to see how we can permeate everything we do with this equity perspective, and to never have that be something that's an afterthought, but really have that always be part of the plan. And then lastly here, I just wanted to let you know that we are just this week working on this last resource on how to talk to children about racial trauma and racism. And so that should be out very shortly, I would imagine probably by next week. And you can take a look for that if that's something you feel would be helpful to you. All right, so here again, I just wanted to pause because I know you all have such fabulous ideas. It was so great to see the ideas coming in before. And so what resources have you found to be most helpful in your work to address racism? And with a particular focus, I would say, on children and families. So I believe that the chat is open again and that you can start entering answers.
We have some responses coming in. One is teachingtolerance.org. People just thanking you too, Jessica, for including this in the presentation. Somebody's mentioning the Bible,
Mm-hmm.
and cultural competency trainings.
Mm-hmm. I love that variation. I mean, that's right. People find different resources, you know, resonate for them. So it's great to have that kind of variety from religious, you know, support to research.
People mentioning peer groups and churches and the Black Lives Movement information. Again, cultural training, listening to others, talking less. Booksforlittles.com. Is somebody's putting that in? Somebody's mentioning their local human rights commission. So yeah, a lot of really interested and varying resources.
Great, thank you for putting those in there and sharing with one another. In that way, I think this has good community of practice potential, and so that I'm sharing, but so are you. All right, so feel free to keep sharing, and I'm just going to go to the last piece that I wanted to make sure to get to today, which is just to give you a quick orientation to our website. Here is our landing page, childtrends.org, and you'll see if you go to that page that you can sign up for alerts and enter your email address in the Stay Connected box up at the top of the landing page. And there's also a magnifying glass up there so that you can enter particular topics. And then there's a drop-down menu. Let me see whether I can actually get the technology to work well enough to show you this. Great. Okay, so you can see up here, can you see my cursor? Hopefully. But at the very top, here's the Stay Connected. So if you want any further information, you could go there. You can connect with us on social media, all up here. And you can also make it accessible if you need that accommodation. And then there are these drop-down menus, and one is about us if you're just interested in finding out generally what we do and who we are. Then there are particular areas of research, although I have to say we do much more than this, but these are some general catch-all categories: child welfare, early childhood, education, family and parenting, health, juvenile justice, poverty and inequality, race equity, social emotional development, teen pregnancy and reproductive health, trauma, and youth development. I'm happy to say trauma just made it on this last year. And then probably the other thing that would be good for me to show you is the data bank. Now, before I came to Child Trends and when I was teaching, I used the data bank all the time. And I don't know whether it's not, I don't think it's quite, it's just taking a bit. So what's really interesting about the data bank is that you can get the latest information and statistics on any topic that is of interest to you with children and families. And so you can pick a particular topic. And so let's pick ACEs, and you'll see information, kind of key facts, you'll see trends. And so what we do is we take our own data, but also national data sources, and summarize them for you so that you can basically have a shorthand to understanding the issue, including, you'll see in graphs and resources and where the data comes from and all of that. So I often find that to be a very helpful resource to run into the data bank if I just need to grab some statistics for something. And maybe actually you may or may not know about these two pieces of work. So we have the Early Childhood Data Collaborative. And so if you're an early childhood person, this supports specifically policymakers to use data systems in a coordinated way. I won't spend a lot of time there, but if that's of interest to you, please feel free to go. It's over here. And then I also wanted to show you our Hispanic Institute, which just is one of my favorite things that we have. So this is a collaboration with NORC, and we really try to keep up on research for Latinx populations, and it can be in many, many different subjects. So we have lists of publications, and you can get to know more about the experts and look at the blogs, etc. But there are some just wonderful resources that come out of there. So I think we're probably about at time, if I'm not mistaken. And so I just wanted to say a huge thank you for listening to me talk this whole time, and look forward to any questions that you have.
Thank you so much, Jessica. And we do have questions in the Q&A, so we will try to get through as many of those as we can. I know a number of you have asked about the slides, and yes, you will get the slides from the presentation today. You will get them emailed to you, and additionally, we dropped the link into the chat, and we can do that again, and there it is. So you can just go directly to the slides if you'd like, and you can download them there as well. But you will get them in about 7 to 10 days. And just a reminder that you will also get a certificate. If you join today, you'll get a certificate for continuing ed of 1.5 hours, and you'll also get that emailed to you in about 7 to 10 days. So So yeah, so let me start with the questions here. Carrie was asking what national campaigns of outreach are planned using community health workers, if you know of any.
That's a really good question. I actually don't know offhand specific initiatives. However, if you want to follow up with me by email, I have colleagues who do, and I'm happy to get you that information. I'm sorry, I don't have it on hand right now.
Okay, thanks. And Larry has a comment about he got a question from a sixth grader. What happens after I die? And he's asking, are you finding more discussions around death and dying in your research during the pandemic?
Absolutely. There's a lot about death and dying and safety. We're actually, for the Natural Disaster Trauma Toolkit that we're developing right now for child welfare and juvenile justice, we're interviewing youth who are involved in those systems and going through the pandemic. And that has absolutely, we've only run 3 groups so far, but that has been a theme throughout. The other theme that we hearing a lot is that systems pay a whole lot of more attention to kind of logistics, where people are living, basic necessities, without thinking about things that affect their emotional well-being, and without having conversations about things like death and dying or the safety. A lot of youth we interviewed are worried about their biological families. Are they safe? You know, are their elderly relatives okay? So yes, there's a lot, I'm hearing a lot of anxiety about that. And luckily, there have been many good resources developed for both children and adults to address death and dying in the life cycle. Though I think, this is also a special case, and we need to add, we need to acknowledge that that's the case.
And then along with that, will this pandemic be considered an ACE score in general among children?
So it depends how you define an ACE score. I use the term adversity because to me that is widely representative of any adverse experience. So I would certainly include it. And there are actually numerous scales that are available in the trauma world that do include and pandemics. The ACEs original measure was developed, the original study several years ago. So I don't think that will change, but it may be that the CDC's ongoing work, it would be hard for them to not acknowledge this at this point. So it will be interesting to see, but certainly in terms of the grantees that I'm advising and working with and in my own projects, we are including that. And on the flip side of things, I'm struggling myself, I just will admit, with this whole idea of whether we're having, whether the whole country is experiencing trauma, right? Whether this is a collective trauma experience. Because, for some people, it will lead to trauma. It certainly creates all sorts of adversity for everyone. But it doesn't necessarily mean that everybody's going to develop trauma symptoms. So it's another just push for, just because someone checks off, I was through a pandemic, doesn't mean that we want to pathologize every single person, with that profile. Or we'd be pathologizing pretty much everyone in the world at this point.
Right. So Natasha has a good question about what is being considered on a national level to ensure safety of children returning to school and daycare?
Mm-hmm. There are many, many working groups going on right now. And what I've been happy to see is that schools are talking to schools and childcare programs are talking to childcare programs. And both the private sector and the public sector have stepped up to facilitate those conversations. So, I think about like the Early Childhood Connector is one of the ones that I'm on because I tend to specialize in early childhood. And there is an ongoing conversation that's probably 20 emails a day about just that. How do we do this? Originally there was directives that every time you touched a child, you had to change their clothing. How do you do that with a baby? So ultimately, I hate to kind of put it this way, but I think that programs and schools are going to have to do their best to align with the best, with safety practices that they can manage, but also deal with the reality that you can't change a kid 20 times a day, right? And young kids can't social distance. And masks are scary. So for instance, in my infant work, one of the things that we're doing now is getting face shields that are completely clear, so that, because babies go a lot by facial signals. But I think that's true for older people too. Everybody, not everybody, but most people really look to body language and faces to understand what's happening. So I think the less interference there, the better.
Yeah. Bonnie's asking, how should families manage so many online activities? It's a good question.
Meaning the requisite homeschooling? Do we know?
If you want to clarify, Bonnie, in the Q&A, but I'm assuming just so much, going on, homeschooling, and everyone is doing everything virtually and online.
Yeah, I mean, my opinion is most people are not. It is like going back to the idea that women can do it all, right? Or that families can do it all. I mean, you cannot work full-time, educate your child full-time, and do everything else that you've got to do. And so, we're seeing that. You probably all are seeing that, right? In meetings you're having where kids are going through, and, the dogs are all over the place, and all of that's happening. So I think actually, obviously to the extent that you can limit that time so that you can actually be together as people is better. Some parents have chosen to follow some instructions about schooling and not follow others. And I think, this is one of those times that may be necessary for some families. So I guess my final piece of advice is don't try to do it all. It's not possible, and it shouldn't. That type of burden should not be on parents. That's a societal issue, not a parent issue.
Mm-hmm. I think you may have addressed this after the question came in, but we had a person asking if you could speak to just this added layer of U.S. unrest related to the police and racial justice and during the pandemic. And she's asking, should we follow the same recommendations to support children?
So I think, many of the recommendations, apply across, right? Good care from a primary caregiver is always going to be helpful. Being able to have conversations with your kids in age-appropriate ways is always going to be helpful. But the reason why we're producing a new piece on this is because it's not the same. So there are, you hear conversations about the talk, right? So having the talk, meaning talking about police brutality and, safety, for children of color around law enforcement is not something that white families typically do. And, is not something that you necessarily do in this COVID context. So it really is layering on what's clearly a long-standing set of issues, for Black families, since slavery, for Native American families since white people came to the country and took their land, and so all of that has those have elements to themselves. So I would really think of this as more like cumulative trauma or complex trauma than I would as equivalent.
Okay, great. Thank you so much. A question here about if a parent with history of substance abuse is about to be reunited with their child due to recovery, the pandemic and quarantine put them at risk of relapse. Have you seen many families that have lost the ability to be reunited for this reason, either temporarily or permanently?
such a good question. I don't think we really know the answer to it yet. I think it's early on, and I haven't seen any kind of reliable research. So I can only just say anecdotally, I am definitely hearing about it. For sure, I have heard multiple stories of families who have relapsed, mothers who have relapsed after they have lacked access to their kids, or, but there are also other stressors they're going through, right? So it's hard to sort of pinpoint what's going on, but that is certainly, anecdotally, I will say that I've heard a number of parents identify that as one of the things that threw them back into addiction.
Yeah. Just quickly, someone is asking the name again of the California Clearinghouse.
Oh yeah, so the California Evidence-Based Clearinghouse, you can CEBC. You can just put it in Google, you'll see it, and you can look at all sorts of practices. It's largely got a child welfare frame on it, but most of the mental health interventions that we use with kids are on there. And so it's a really nice database to search.
Okay, great. Yeah. And we'll try and get that out to everyone as well. And we do have a question here about the resource you mentioned on adversity and resilience. I know there's a 2-year opportunity there for people to access that. So we'll get that, and you guys will get the slides, and so that link will be in the slides as well for you to access that.
Yeah, that's great.
And we have a question from Cheryl asking, what screening tools would you suggest? And I'm assuming this was at the beginning of your presentation, you were talking about some of those tools. So,
so very much depends on age, and and very much depends on what you are looking to find. But the trauma world has a number of very common screeners that are used. And so for young kids, for example, there is the young child PTSD checklist, or there is, I'm trying to think of the acronyms I'm used to. There are the ones that are for very younger kids. You want to be looking for a dyadic component in there, right? Particularly for, babies and preschoolers. So it's looking at attachment. Oftentimes older screening tools have been used with younger kids and failed to pick up on changes of trauma symptoms for that reason. And then most of the kind of widely used trauma screeners, actually I was just going to pull up the website, but probably don't have time. Sorry, what was I going to say? Anyway, the thing that you want to be looking for, and you feel free to reach out to me and I can give you a list of names, but I would say the characteristics you want to be looking for is that A, it asks about exposure, that it always has an other category because we don't know what kids and families have been through, and that it also asks about symptoms or reactions, right? So that you don't just know what they've been exposed to, but you know how they're doing. And then I would never do that outside of the context of a developmental screening, because we also don't know, whether there are learning issues at hand, mental health issues at hand, what else is playing into it. So you really want the whole picture of the child.
Good, thank you. Are we seeing any increase in mental health utilization in the child or adolescent population during COVID-19?
Also something that I think has not been determined yet, though I imagine we'll know soon. My guess is that there'll be kind of opposing forces, that, more kids will need it and maybe are starting to access it, but availability has been short, and telehealth doesn't work with very young kids. And even actually a friend of mine, for instance, her son needed to be hospitalized when the hospital closed, and they had an online program, which is pretty fabulous, that they developed it right away, and it just didn't work. It just wasn't something that he could hook into. So we'll see how it all plays out.
I do want to thank you all for joining us and joining the webinar today. I want to thank Jessica, our speaker, thank you so much for
Pleasure.
joining us. So thanks, and have a great rest of your day.
Yeah, take care. Be well, everyone.